Hi, my name is Cory Holmes. I'm the manager and also an X-ray tech for Monument Health. I work in the X-ray departments in the Rapid City clinics as well as the orthopedic and specialty hospital. I've been in the imaging field for over 25 years. I went to X-ray school in Mitchell, South Dakota. I graduated with an associate's degree, and after that I was certified in radiology. I'm also certified in CT, and I've recently received my bachelor's degree in medical imaging. In high school, I was involved in a lot of sports, and during those sports times, I ended up getting a lot of injuries, which led me to a lot of doctor appointments. During those visits, I started getting really interested in the medical field, and especially into radiology. When I wasn't in sports after school, I would go down to the radiology department and shadow the X-ray tech, and ended up being an assistant for her throughout my last year of high school. So since graduating from X-ray school, I have had multiple different jobs, but with only two different organizations here in Rapid City. I've been an X-ray tech in an orthopedic clinic. I've been an orthopedic tech, which is a job that you take casts off and put casts on. You remove stitches and staples and do orthopedic post-op care. I've also been in leadership in the two different organizations. In the last 11 years with Monument Health, I've been an X-ray tech, I've been a CT tech, an ultrasound tech. I've also been in leadership. I've been a supervisor, and then I'm currently in a manager role. One of the things that I didn't realize going into X-ray was after I got done with school, there's many different options for you to grow into different modalities. So when I got out of X-ray school, I thought X-ray was working at a clinic or a hospital was really my only option. And in the last 25 plus years that I've been in this field, now there's so many more other areas that you can grow into. Like I said, CT and ultrasound I've done in the past. There's other things, other modalities such as MRI, and other leadership roles. When we interview candidates that come out of X-ray school or have been in the field for a while, chances are they know how to take the X-rays. And so what we're looking for is more on a personal, how their personality is, their teamwork, and how they're going to overall have a good environment to work in. A typical day for an X-ray tech in a clinic setting would be when they come in the morning, they have to do quality assurance type programs. They have to warm up the X-ray tubes and make sure that everything's in good working condition. Then mostly throughout their day is patient care. They're taking X-rays throughout the day. There's also a lot of computer work that goes along with that. Now that we're having a digital background with the new technology that we have, has required us to use the computers a lot more. One of the biggest things I've learned in the last 25 years is technology in the medical field, and especially radiology, continues to grow. About every 5 years, there's always a big change in each modality in medical imaging. If I was to go back to high school and determine if I wanted to go into this field, the answer would be yes. I would approach it in a little different way. What I did was I went and got my associate's degree right away. I worked in the imaging field for 20 years before getting my bachelor's degree. One thing I would have done differently is I would have continued my education early on, so I would have gotten my bachelor's degree earlier to open up maybe more opportunities for me earlier than they have. Advice I always give to students is if they're interested or think they may be interested in the medical field, to reach out to their local hospitals or clinics for some shadowing opportunities. By shadowing the areas and the departments, it gives you a good idea if this is something you really want to do for your future. Now I'd like to take time to show you what we would do for a normal 3-view X-ray here at the Orthopedic and Specialty Hospital. So for the first X-ray that we'll do of this 3-view knee series will be what we call an AP projection, or anterior to posterior projection. Every X-ray needs to have a marker on there to determine if it's a right or a left, and that's for legality reasons. So these markers that we place on there also has the tech initials on them as well. So if any point that we need to go back and look at the X-ray, we can determine which technologist took the X-ray. So for this first picture, like I said, it's called an AP projection. What we do is we set it up so we center right on the knee joint and make sure that we include both sides of the knee and the top and the bottom. Anytime that you do an x-ray, you always want to make sure that there's no chance of pregnancy. And if anybody's in the childbearing ages, what we do is always put a lead shield on there to protect them. So this would be our AP projection. So the next projection that we'll do is we call it a lateral projection. And what that is the exact 90-degree view of this projection. So I'm going to have her turn towards me, and you're going to see that now we'll be doing a side picture. So we'll bend her knee a little bit. We'll make sure that everything's lined up just right. The lead shield now comes on this side to protect from the radiation. And we'll bend her knee a little bit and then make sure that that marker is still on there. So that is our lateral image. So for our third picture, what this image is it's mainly of the patella view that we do to make sure that there's a good joint space between the kneecap or the patella and the knee. And so I will take just a minute too to talk about this detector. This is a digital detector that's the newest technology that we have within medical imaging. What this allows us to do is, just like your cell phone, you can just take many pictures on it without having to replace anything. This detector, we can take pictures all day long. It has a battery on the back that needs to be changed once a day. So we'll go back to this patella image. So what we do is we ask the patient to hold this detector right here. We take we also make sure our marker's on there. And then we take our x-ray tube and we adjust the angle so it opens up the space in between the kneecap and the femur. So this is our third and final image.